Hello everyone, welcome to my channel E to Z Nursing Notes. I'm Rupinder and today's video is about prioritization. As I've already told you guys that prioritization and delegation are the two very important topics in NCLEX RN exam. So today I will be taking up the prioritization topic. I've already made a video on the delegation topic and I will be posting the link of that video in the description box. So, what do you mean by priority? It is deciding which needs or problems require immediate action and which ones could wait until a later time as they are not urgent. So, in the NCLEX exam, they will be asking you what is the best, most important, or first or initial response by the nurse. Now, as a nurse, when you are on the floor, you will be having 4 or 5 patients, and you cannot take care or address to each patient's need at the same time. So based on you will be assessing your all the 5 patients, and based upon their needs you will decide which one which patient requires immediate attention and which ones can be kept, you can take back, you can care for later, right? So this you can decide only on the basis of priority when you know how to prioritize your actions or your nursing care, right? So the prioritization of care is based on the levels, like it can be level on level one is which includes airway, breathing, and circulation, and the vital signs. And first, once these are met or attended, then you can focus on the other needs like the altered mental status, acute pain, untreated medical problems, hypoglycemia and diabetic client, chronic pain, acute elimination needs, abnormal lab values, or risk for infection, right? Or you can classify the priority needs as based on emergent, urgent, or non-urgent. So the emergent are the client needs that can be life-threatening or could result in harm to the client if they are not treated or attended immediately. Urgent are the non-emergency and non-life-threatening client needs, and non-urgent are which needs that do not directly relate to the illness or prognosis. Right? I will discuss about this later. So how will you identify in your NCLEX on exam that which are the priority questions? So there can be two types of questions. Either there will be direct questions in which you will be asked after giving you the scenario, they will ask you which client is the priority, or which lab value is the priority to report, or which what is nurse's priority action. Or it can be indirect, asking you questions like which client should the nurse assess first, which client requires most immediate assistance, or which client should the nurse call back first. Like in case of there will be a scenario that the nurse received the following 4 calls, and based on the scenarios, which client should the nurse call back first, right? Now you have to look for the keywords in your answer options to search for the high priority indicators, which can be found in the answer stem as the new change or sudden change or rapid if there is any change, or there is worsening client condition, or there is a post-op client, or is a client who is returning from a procedure, especially from the non from the invasive procedure. Now, the strategies to follow in the NCLEX RN exam to attempt the priority questions. There are three strategies which can be used, and this should be you will get the idea of which to use based on your question, right? So, if the first one is the ABC strategy, that is the airway, breathing, and circulation. Second one is the Maslow's hierarchy needs, and third one is the nursing process. So you will get to know from the question stem that which scenario you will be using. Let's first discuss the ABC strategy. So the ABC strategy is based it's based on the levels of care only. Like first level of care is airway, breathing, and circulation. You have to give importance to those answers or options. And the if the answer options are between this level 1 and level 2, so first of all you will identify whether it is an airway problem or there is a pain problem. So if there is a choice, there are options like with the airway problem, difficulty in breathing, so you will give priorities to these, and in between these two, airway will be given priority over breathing, right? Then now the answer options, when you in the real life scenario, when you actually sit for the NCLEX RN exam, they will not specify directly that this is the airway is affected of in for this patient, or the circulation is compromised. So you have to identify whether the problem, like uh, the problem statement for the client, is related to the airway, breathing, or circulation, or it is abnormal vital signs, or it is abnormal lab values. So you have to look for the keywords that identify the affected category. So what all things will lead you to like what all things you can look for to make sure to ensure that the client is having some airway problem. So the answer option will be having these keywords like throat, the patient is having throat swelling, or he's having noisy or squeaky breathing, or there is stridor, or the patient has foreign body aspiration, or is unconscious and vomiting. So if the patient is unconscious and vomiting, obviously there is a chances of aspiration, which is a threat to the airway, right? For the breathing, there can be like the case scenario of carbon monoxide poisoning, high levels of POCO2 values in the lab values. There can be hypoxia, like there is change in like the patient. They may be saying that the patient is having, there is a change in the level of consciousness of the patient, or the mental status, or the patient is agitated and or has become suddenly confused. So these are the normal signs and symptoms of hypoxia. So you will judge that this, okay, this client scenario is related to breathing issue. Or in case of circulation, there is no palpable pulses identified by Doppler, or there is the BP is low or the BP is high. So this means the patient is like they may indicate the patient is having hypertension, stroke, or MI risk, and there may be a patient scenario of hemorrhage. So there may be like sign and symptoms like hardboard, like abdomen, which indicates peritonitis. Then there is low platelet count can be there in the lab values, the INR or the PTT, right? So based on these scenarios, you have to classify which client scenario goes into which section, the airway, breathing, or circulation. And based on that, if it is between the airway and the circulation, the priority will be given to the airway. If it is between the breathing and circulation, priority will be given to breathing, right? But there are some exceptions to this case. So in case you have a client who has suffered a head injury, it is the like that patient will become a priority over the airway, because the head injury patients, they will be their level of consciousness will change suddenly, and it may the airway or breathing can be recovered, but if a patient is head becomes brain dead, the brain that cannot be reversed, right? So head injury becomes a priority over the airway in this case. Also, in case you have a client who has been resuscitated, that is in the case of CPR, circulation becomes a priority over the airway. Usually airway is a priority. So there is one scenario, like example question. The nurse is assigned to care for 4 clients. In planning client rounds, which client should the nurse assess first? So this is a question from the Saunders book. So there are 4 options: a client scheduled for the chest X-ray, a client requiring daily dressing change, a post-op client preparing for discharge, a client receiving nasal oxygen who had difficulty breathing during the previous shift. Now, if you look at the options, scheduled chest X-ray, this is not urgent, right? Client requiring daily dressing change, this is not urgent. A post-op client is important, but then this is being discharged, right? So if the patient is being discharged, the patient is stable. If he is not that stable, he will not be discharged, right? So the only option is where a client is receiving nasal oxygen and who is having difficulty breathing. So his airway is affected or his breathing is affected. So that's why this client is a priority. Another one, a nurse employed in the ED is assigned to triage clients. The nurse should assign priority to which client? So this is asking you directly about the priority. A client complaining of muscle aches, headache, and malaise. Okay. A client who twisted her ankle. Okay, not urgent. A client with minor laceration on finger while chopping veggies, not important. A client with chest pain who states that he just ate pizza and that was made with a very spicy sauce. So this can be an indication of chest pain, can be an indication of MI. It may be suspected MI. So this case, and because the spicy sauce or that becomes a trigger for the MI, so this case, this client is an urgent or this client is an emergent, has an emergent need, so this client would be assigned first, first priority. Taking a look at the Maslow's hierarchy of needs. So the Maslow hierarchy of needs states that the basic needs should be assessed first. So if you look at this triangle, the base of the triangle, the needs at the base of the triangle, they should be satisfied first, and then only the patient can move to the second level of in the triangle, right? So physiological needs, they come first, safety needs, they come second, love and belongingness later, and self-esteem and self-actualization, they come way back after these basic needs. So talking about the Maslow, like how to identify Maslow's physiological needs. So physiological needs are related to oxygen, fluid, nutrition, temperature, elimination, shelter, rest, and sex. Safety or security needs can be both physical and psychosocial. So the physical needs include decreasing what is threatening to the client, right? A threat may be illness, like myocardial infarction, accident, a parent transporting a newborn in a car without using a car seat. That is a physical threat to the physical safety. Or the environmental threat, like a client with the COPD who insists on walking outside in 10-degree Fahrenheit, that is minus 12-degree centigrade temperatures, which could be a trigger for his difficulty in breathing. So let's look at this scenario. A nurse has received assignment from the shift after making initial rounds. Which client should the nurse plan to care first? A client who is ambulatory, seems like the client is fine. A client who is scheduled for physiotherapy at 1 p.m. Scheduled things are not a priority. A client with fever who is diaphoretic and restless. So this is something difficult, like the patient is having some difficulty. The fourth is a post-op client who has just received a pain medication. Now, pain is also a priority, but the patient has just been given pain medication and it will take a while to take in, their effect, right? So, we will put this patient second priority, and number three client, that is a client with fever who is diaphoretic and restless, this will be given the first priority. Now, to attain the psychological safety, the client must have the knowledge and understanding about what to expect from others in his environment. For example, it is important to teach the client and his family what to expect after the CVA, that is cerebrovascular accident. It is also important that you allow the woman who is preparing for a mastectomy to verbalize her concerns about changes that might occur in her relationship with her partner, right? So these are the psychological concerns. So we have to address the psychological needs, and these are given the second priority. Then love and belongingness. The client needs to feel loved by the family and accepted by the others. Esteem, which is when a client feels self-confident and useful, he will achieve the need of self-esteem as described by Maslow's hierarchy of needs. Then self-actualization is when the client must experience fulfillment and recognize his or her potential. In order for self-actualization to occur, all of the lower level needs must be met. Also, we have to take note that pain certainly has a physiological component, but it is given a lower priority in the NCLEX RN exam. So the nursing process strategy, we all know, are familiar with the nursing process. That is, we have to do the assessment first, then we have to analyze this, what our assessment findings are, then plan according to the assessments, and then implement them and evaluate the implementation effect of the implementation. So when using the nursing process to answer the questions, always remember that the first step is assessment. So if there is a case scenario where you are given like four different situations in which the one step is showing assessment, other is concerning implementation, and the another one is concerning the evaluation. So always you will be giving priority to the assessment part, right? So words that indicate assessment in the your like answer options, it would be like you have to look for the words like keywords like ascertain, assess, check, determine, find out, gather, identify, monitor, observe, obtain information, or recognize. Okay. And if in these questions you are asked to select your first, immediate, or initial nursing action, follow the steps of the nursing process. But in case of emergency situation, this is too important. If there is an emergency situation, then assessment is not the priority, implementation becomes the priority. You have to act in the case of emergency situation. Also, I must like focus like if there are two options relating to the same scenario, so you are to assess, like if there are two assessment, so you will be assessing the patient first, and then you will be assessing the machine. Like if you are having like patients saturation is not uh, is dipping, so you have to look for assess the patient's breathing and airway and breathing first before checking that okay, the machine is the cardiac monitor is giving the correct reading, or the SpO2 probe is fine, right? So you have to give patient the priority over the machine. Now you have to look at all the options, and after looking at all the options, you have to identify whether the client is stable or unstable. So a stable client will be a lower priority. Unstable client, which is having who is having acute problem or who has a fluctuating status, will be a high priority. You will identify if there is any medical emergency. I will be showing you the list of some of the medical emergencies, and based on that, you can decide if it is a medical emergency, it will be a priority. You should be able to identify the normal sign and symptoms from the sign and symptoms of the complications, right? So the medical emergencies would be like, for example, wound dehiscence or evisceration, or if the patient is experiencing sign and symptoms of pulmonary embolism, it would be a priority. Or if the patient is having a uterine inversion or prolapse, it becomes a obstetric emergency, right? Or there is like retinal detachment, it is a emergency of the eye, right? So there are some points to remember. Like in case of drug overdose, uh, like in of all the options, if there is a drug overdose option, then it becomes a priority due to the unpredictability of how much the dose, like drug overdose the patient, drug dose the client has taken, and how the client is responding, right? In case of carbon monoxide poisoning, it becomes a priority, as we have to attend to the carbon monoxide poisoning first, immediately or emergently, to prevent the tissue hypoxia and hypoxemia, right? And in case of disaster, decontamination is a priority to prevent further injury. So we have to shower the client to remove any particles of the irritant or the chemical, as this will cause further tissue injury, right? Before doing anything. So in case of post-op clients, any increase in the blood pressure will increase the risk of hemorrhage due to the strain on the sutures, and it will lead to wound dehiscence, which is a medical emergency, right? So you have to decide based like thinking in this scenario situation, right? Then DVT is not a priority if you're having a patient with a DVT symptoms and symptoms of DVT, and is a patient who is having signs and symptoms of pulmonary embolism, then both are related to circulation and airway and circulation. Like DVT is related to circulation, but pulmonary embolism, it is related to the airway, so it becomes a priority. Asthma exacerbation is a priority until it has been settled. Once the asthma like exacerbation has settled, it automatically comes down in the priority. Then if the patient is post-op patient is having nausea, now if a patient this will increase the risk of aspiration, because the patient with the post-op patient will be having the effect of anesthesia and nausea or vomiting. If the patient has, then there are chances that the patient will aspirate and compromise the airway. So this kind of patient becomes a priority. Hypoglycemia, it becomes a priority over the hyperglycemia, as low glucose levels, they lead to seizures and neurological dysfunction, and this may uh, cause more damage. So this becomes a priority. Clients complaining of worst headache of my life, they become a priority, as this may indicate intracerebral bleed or stroke, right? Brain stroke. Client returning from an invasive procedure becomes priority over the client returning from a non-invasive procedure, because invasive means that something has there is some penetration of the device or uh, something, right? So that becomes a priority. Like if there is a patient from endoscopy, like bronchoscopy, and there is a patient from the chest X-ray who's returning to the floor, so obviously the patient from coming from the bronchoscopy becomes a priority over the other one. Sepsis is always a priority. Asthma client who reports sudden decrease or subsiding of the wheeze is a red flag. This is a high priority, indicating that the development of silent chest as airflow rapidly gets reduced due to the increased bronchial constriction, right? Then acute problem is a priority over the chronic problem, like acute pulmonary edema. It is a priority over asthma, right? Which is a chronic problem. Then systemic sign and symptoms take priority over the local sign and symptoms, right? Then unstable condition will take priority over the stable condition, like hemorrhage will be assessed, dealt first before over a stable breathing patient, right? So you have to look for keywords. You definitely I guide you to look for the keywords of sudden change, but this may not always work in all the questions. So you have to be a bit vigilant. Coming to some of the case example questions, like a client going through the intense chemotherapy treatment is admitted to the unit. Which of these would the nurse instruct the nursing assistant to report to prevent the acid-base imbalance? So this is indirect question uh, in which you have to like assess that which a need will be a priority or should be reported immediately, right? So hair loss during the morning bath, this is not a problem. This is a usual effect of chemotherapy, like an expected side effect of chemotherapy, you can say. Complaints of pain associated with exertion, because this is a normal. Then failure to eat all the food on the breakfast tray, this is normal for the patients on chemotherapy. Now, prolonged episodes of nausea and vomiting. Now, this can lead to acid-base imbalance also, and this can affect the airway. The patient, there are chances of the patient getting aspiration also. So this is a priority over all other options, right? Next is the assigned LPN of the unit reports to you that the client's blood pressure and heart rate have decreased. And when her face is assessed, one side twitches. What is the most appropriate thing to do as a nurse? Assess the client's pupillary reaction to light, obtain a neurological exam for the client, review the client's morning calcium levels, retake the client's blood pressure and heart rate. So we all know that face twitching can be due to the abnormal calcium levels. So you have this is reviewing the client's morning calcium levels become a priority. Two student nurses Two student nurses are assigned to a client with lung cancer who has received oxycodone 10 mg orally for pain. During the assessment, which finding should the student nurses report immediately? Now you look at this word immediately, it shows that it is a priority question. Now you have to prioritize all the four options. Right. First one is decrease in pain level. So decrease in pain level from 6 to 2, this is a good thing, right? Or this is the expected outcome of the pain medication. Heart rate of 90 to 100 beats, this is okay. With pain, the heart rate increases. Request by the client that a room door be closed, that is okay. Respiratory rate of 8 to 10. Now, because we all know if we look at the medication, so this is oxycodone, and the uh, unexpected effect is lowered respiratory rate, right? So 8 to 10 respiratory rate is low, so this is a priority and should be reported immediately. Then is a 90-year-old client is confined to the unit for 2 weeks. He has been receiving antibiotics for more than a week and tells that he is having frequent watery stools. What action will you take first? Now this is again this is a direct question, a priority question, which because they are asking you what action you will be taking the first. Like place the client on contact precautions, because I'll come to the option, discuss this option for later. Second is educate the client about correct hand washing. This is okay. Notify the physician about the loose stools, that is should be done. Get this stool specimen for culture. That should be done. But first, the client should be placed on contact precautions. Although this may not seem like a valid option, but a client who is on 2 weeks of antibiotics, he will be on a high risk of um Clostridium difficile infection, right? So he should be placed in contact precautions first in to prevent like hospital acquired infections to the other to the patient to other patient as well as to the staff. Which action will the nurse take to most effectively reduce the incidence of hospital related urinary tract infections? The options are: make sure the client have adequate fluid levels, educate assistive personnel on how to provide good perineal hygiene, restrict the use of indwelling catheters, perform dipstick urinalysis for clients with risk factors for UTI. So out of these, because indwelling, now this we have to look for which is the invasive option. So indwelling catheters, this is the more invasive option, and there are high chances of transmitting infection to the patient. So this will be a first most effective method of reducing the hospital-related UTIs. Next is during a class discussion, a 50-year-old professor suddenly feels left-sided chest pain, dizziness, and diaphoresis. What is the priority action when he arrives to the ED triage area? Now, this is asking you directly about the priority action. So, first is now these all options will be related to your nursing interventions related to chest pain. Now, you have to prioritize these interventions. Supply oxygen via nasal prongs, place IV line, notify the ED physician, set the client on continuous ECG monitoring, right? So, first, because this is an emergency situation, so we will be acting first. So, supply oxygen via nasal prong because the chest pain it would be related to insufficient oxygen supply to the heart. A group of passengers enter the ED with complaints of cough, tightness in the throat, and extreme periorbital swelling. This is a good. There is a strong odor exuding from their clothes. They report exposure to a gas bomb that was placed on the bus terminal. What is the priority action? Now, this is the exception which I was talking about. Readily transfer the clients and visitors from the area, check vital signs and auscultate lungs, assess the clients in the to the decontamination area, direct clients to the cold or clean zone for immediate treatment. Now, in case of like disaster, which is like chemical exposure, decontamination is always the first thing to do before acting on anything else, right? No, although like if we talk about the first option, like readily transfer the clients and visitors from the area. So this is in case you are on the spot where there was exposure. So we will be like evacuating the people from the affected area, right? That is not a valid option for this question. A high school student comes in the triage area alert and ambulatory, and his uniform is soaked with blood. He and his classmate are sounding. We were running out around outside the school and he got hit in the abdomen with a stick. Which statement should be a priority? The stick was absolutely filthy and muddy. He has a family history of diabetes, so he requires attention right now. He pulled the stick out because it was too painful for him. There was plenty of blood, so we used 3 gauze. So out of this, now this is a puncture wound, right? So puncture, in case of puncture wounds, we never take out the puncture device, right? As it may cause, it will lead to hemorrhage and which can worsen the client's situation. So this is the priority statement to be acted on. You have obtained the following assessment information about a 3-year-old who has just returned to the pediatric unit after having a tonsillectomy. Which finding requires the most immediate follow-up? A frequent swallowing, hypotonic bowel sounds, complaints of sore throat, heart rate of 112. Now, it's a post-surgical clients will can have heart rate a little higher side. Then complaints of sore throat is normal. Hypotonic bowel sounds will be there because the definitely the client would be empty and pure. Frequent swallowing is a concern and it should be immediately followed up because this means that there may be hemorrhage is there or there is some kind of bleeding because of which the client is frequently swallowing. So this becomes a most immediate follow-up thing. You are supervising a nursing student who is providing care for a patient with thoracotomy without chest tube. What findings would you clearly instruct the nursing student to notify you about immediately? So this is again a priority question. Chest tube drainage of 10 to 15 ml per hour. So this is not a concern. Usually if the chest tube drainage is more than 100 ml per hour, that is a concern because this means that there means some kind of hemorrhage. Continuous bubbling in the water seal chamber. Complaints of pain at the chest tube insertion site, that is quite normal. Chest tube dressing dated yesterday, this is nothing not to be something to be notified. So continuous bubbling in the water seal chamber is a problem of concern and it should be immediately notified. You are providing nursing care for a newborn infant with respiratory distress syndrome who is receiving nasal CPAP ventilation. What complications should you monitor for this infant? So a patient on CPAP ventilation, you have to like when the options are pulmonary embolism, bronchitis, pneumothorax, and pneumonia. So we all know that on when mechanical ventilation, there are chances of barotrauma, which can lead to air in the lungs and which will cause pneumothorax. So we have to monitor the child for the complication of pneumothorax. You are making a visit to a 50-year-old patient who was recently hospitalized with right leg deep vein thrombosis and pulmonary embolism. The patient's only medication is enoxaparin subcutaneously, which assessment information will you need to communicate to the physician. The patient says that her leg aches all night. This is a normal sign and symptom of DVT, so this is not something of concern. The right calf is warm to touch and is larger than the left calf. This is a normal sign and symptom of DVT. The patient is unable to remember her husband's first name. So this is the patient's level of consciousness is the patient is confused or patient is level of consciousness is affected. So this is something of concern. There are multiple ecchymotic areas in the patient's arm. This is because the patient is on enoxaparin, which is given subcutaneously, and there is subcutaneous tissue is affected when the patient is getting this medication. So this is the usual effect. So in this scenario, you can see the all the things are related to patient, but then some of things are the normal sign and symptoms of the patient's diagnosis, right? So this is not a priority. The priority is what is the sign and symptoms of the complications, right? Next is Nurse Sky is assigned to the cardiac unit caring for 4 clients. He is preparing to do initial rounds. Now, which client should the nurse assess first? A client scheduled for cardiac ultrasound this morning. This is a scheduled thing, not a priority. A client with syncope being discharged today. So if the patient is being discharged, definitely the patient is stable. A patient with chronic bronchitis on nasal oxygen. A client with diabetic foot ulcer that needs a dressing change. So dressing change is not a priority, but a client who is having a airway problem and is on oxygen, this would be a priority. A client presents to the emergency room with dyspnea, chest pain, and syncope. The nurse assesses the client and notes that the following assessment cues pale diaphoretic, blood pressure of 90/60, respirations of 33. The client is anxious and fearing death. Which action should the nurse take first? Administer pain medications, administer IV fluids, administer dopamine, administer oxygen via nasal cannula. So the patient is having a respiratory rate of 33, or definitely the patient is having difficulty in breathing. Now, taking into account the ABC strategy, so airway will be given priority over the blood pressure and everything else, right? So, answer D is the option. Nurse Paul is developing a care plan for a client with bariatric surgery for morbid obesity. The class nurse should include which of the following on the care plan as a priority complication to prevent: pain, wound infection, depression, thrombophlebitis. So now these are wound infection is the topmost priority because this can lead to sepsis, and sepsis is not a good thing. It can lead to death. So this is the top priority. And these are some of the examples. I hope you have got hang of how to attempt the priority questions. Best of luck to all of you guys. Thank you very much.